Hi everyone, this is Choudhary and you are watching Dr.RUkmani's Health Update. My today's topic is Achalasia Cardia. This is a rare chronic disorder in which you have like regurgitation of food. Dysphagia means difficult swallowing. So this is rarely found, but this is the commonest motor dysphagia disorder. So in today's video, I'll be giving all the information about like what is this condition and how it occurs, what are the causes, theories behind this problem, and what all symptoms and diagnostic criteria, what tests required, best effective homeopathy medicine treatment in allopathy, and dietary changes. So you are requested to watch complete video for complete information. If you're watching first time, please like, share, and subscribe my channel bell icon to get notified. So let's commence. Achalasia Cardia. See, achalasia means spasm. Muscular spasm, you can say. So before talking about this condition, let's talk about the upper GI tract. Required to know that once you start eating, so your food you have in the mouth and that it goes down in your food pipe, the tube that is called esophagus, that is food pipe, and the food pipe that connects your stomach, the lower part of the esophagus connect with the stomach, and the end is called lower esophageal sphincter. Sphincter means muscular control of the body part. So esophagus, the food pipe too, the upper esophageal sphincter and the lower esophageal sphincter. So once you start swallowing the food, so there is a proper rhythm, there is a proper coordination of both these sphincters. Means once you swallow, so upper esophageal sphincters open up, and once it goes down, then this closes, and you have food in the esophagus, and there are peristalsis movement. Then it goes down to the stomach, and once it goes to this, then closure of the lower esophageal sphincter. So the food doesn't come out, and you don't have any problem. What happens in Achalasia Cardia? This lower esophageal sphincters, this and the peristalsis movements are affected. Means there is a nerve damage, there is a poor control of all these peristalsis movement, and the sphincter, they doesn't work properly. So there are problem with esophageal sphincters and peristalsis movement. So due to these problem, you have regurgitation of food, and due to that there is a malnutrition, deficiencies. So these are the consequences of this problem. So let's talk about the causes part, that how it happens and why it occurs. What are the theories behind this? What are the causes and what are the risk factors? There is no direct cause, no exact cause. There are certain theories that are believed, and the most common believed theories: nerve damage, the nerve that supplies to the esophagus, the food pipe. There are certain damage in that nerves, and at times it is considered autoimmune disorders. Means it falls under autoimmune category, and at times there are certain diseases that are linked with this condition. These diseases can be stomach cancer, Chagas disease, neurodegenerative diseases. So this is how the condition progresses with time. And then what symptom you have, what suffering you have. The commonest, the chief symptom, that is dysphagia, means difficult swallowing you have. This is the most common symptom found, and you have difficult swallowing, and due to that there is a problem with the sphincter. So you have regurgitation of food, the food comes out in your mouth, and you have, due to that, there is a malabsorption, there is problem in digestion and absorption. So there are deficiency of nutrition, and you are underweight, you have weight loss problem is there, and you have dryness in your mouth, dryness in your eyes, dryness in your nose, and at times there is a food to be goes down to the stomach. In spite of that, it goes to the lungs. So this is called aspiration. So in that case, you have aspiration, pneumonia, and night cough is there. Diagnosis, your physical examination as well as there are x-rays, imaging tests are there, barium swallow meal is there, using are done, that how the path of the food that goes down, how it is like that, whether there is a position of accumulation of any kind of food, like for that purpose it is done. And there is like esophageal manometry. This is to be done for the access the forces and the muscles contraction of the esophagus. For knowing that part, esophageal manometry is done, and upper GI endoscopy is done for the clear view, for the exact view of the esophagus. So these are certain tests: barium meal, x-ray, esophageal manometry, and upper GI endoscopy is done. These are certain tests in allopathy. See, you are having spasm, means there is a spasm and there is a poor control and of the muscles and nerves. There is a poor control. So you are given relaxant. You are given relaxant. In severe cases, critical cases, there are surgeries. Surgeries are done. About the dietary changes part, that what diet you are supposed to have. See, this is the case of dysphagia. So advised to have shorter meal, smaller meal, and just eat at upright position and do not lie flat. These are the certain lifestyle changes you are supposed to adopt. Yes, there are several medicine in homeopathy. Couple of medicines we have, but each and every medicine, it depends that what is your constitution, what symptoms you have, and what are your aggravations, means when your symptoms get aggravated, and what are amelioration, mean when your symptoms are better. These things matters. We have to consider each and every symptom. This is called individualization, and we have to consider you as a whole. This is called holistic. Having certain medicine, but these are not the limited medicine. There are other medicine as well. So you must be knowing about carbo-based digestive property, that this is given in indigestion cases, gastric problem. Carbo-based is very effective having chest pain, there is a heartburn, and carbo-based is the main indication that when you have suffering of upper GI tract, means you are having a problem upper GI tract. Of course, you are having problem in esophagus. So in that case, you can take help of carbo-based. See, the quantity can differ. You can even buy a smaller quantity for your case. This is for the clinic purpose, and go with the lower doses. This is 200. Just go with the 12 or 30. Start with the lower doses to be on safer side, and just use 1 or 2 drops directly on tongue before having your meal twice or thrice in a day. Lakashna is known for its property that even you cannot swallow the liquid food as well. You having for the liquid, you cannot even take liquid. There's a problem with liquid also. So in that case, you can use Lakashna. Again, go with the lower doses, 1 or 2 drops directly on tongue before having your meal. Phosphorus is given in regurgitation cases, means when your food comes out in your mouth. So in these cases, you can take help of phosphorus. Same 30 or 200 potency, 1 or 2 drops before having your meal twice or thrice in a day. Kalikab is a medicine that is given when you have, there is a food is stuck in your esophagus. So in that case, you can take help of Kalikab. Alumina tops the chart almost, and alumina is given when you have dysphagia, difficult swallowing. It is given when you have solid dysphagia, means you are not able to swallow the solid part of the food. So this is given. These are not the limited medicine. There are other medicine as well, like we have Robinia, we have Nux vomica. Person, the individuality. So hopefully this video can help you. If you find this video knowledgeable, informative, please like, share and subscribe my channel. Press the bell icon to keep watching, keep updating. Thank you for your time. Thank you for watching. Thank you.